it's been published today, the government is taking forward some very far-reaching reforms of the NHS, which will put collaboration instead of competition at the heart of the system, create these new local place-based partnerships between the NHS and local government, a lot there to talk about as time goes on through, more central control of the NHS, no question that that's in there, and hopefully better workforce planning. And that's really a key part of the contribution we can make to this agenda as we go forward. It's not yet the fundamental reform of social care that many of us have been calling for, but we think it may have opened the door to that. So that the social care workforce can start to receive the parity of esteem, the recognition, the respect, the remuneration they deserve for the work they do. In terms of the agenda then, I'll just go back to the previous slide if we may, Emma, thank you. We're going to open, just as I finished, with keynote speeches from three people that you'll be very familiar with. Just to say, we had hoped to have Jeremy Hunt with us to speak today, but unfortunately he managed to fall over in the ice this morning, broke his arm, and rather than being with us, he's in the very capable hands of the NHS, being looked after. And I'm very grateful, delighted that Alistair Burt has been able to step in at very short notice to join the conference as one of our keynote speakers. So thank you, Alistair, for stepping in that way. And just before we kick off with that, we can see once we've gone through the conference and the summits, we'll come back as a closing plenary. Final reminder of just some housekeeping. I think we're all getting familiar with this now. The session is being recorded and we will be sharing it online in due course. Please keep your microphone on mute in the usual way. We've got a way for people to use the hashtag and to continue the debate on Twitter. And please do use the chat function to share your opinions, ask questions, find out more information. Okay, let's, without further ado, turn to our opening plenary session. Delighted to have three speakers with us today. And I'm going to begin by inviting Christina McAnea to speak. Welcome, Christina, and the screen, as they say, is yours.
Thank you very much, Phil. So I'll try not to take up too much time because we have got a packed agenda, and I'm so grateful to the great lineup of speakers that we've got today. And thank you to everyone for attending, as Phil has said. As the new General Secretary of Unison, I've made social care one of my top priorities, one of the top priorities for our union. And because there really is a huge amount of work to be done, particularly if we are to bring about greater parity between health and social care workers, something that's often spoken about, but which the pandemic has shown is further away from being a reality than ever. Our focus today is on the workforce and specifically the need for a workforce strategy for social care. Now, 3 years ago, that process began that ultimately led to last summer's NHS People Plan. It all started with Health Education England producing a draft health and care workforce strategy for the next 10 years, a substantial 142-page document, which came with its own section on social care. Unfortunately, that section began, I think it was on page 67 and finished on page 71, a whole 5 pages out of 142. Now, Skills for Care did undertake their own separate work on this at the time, but it's still hard to escape the sense that social care was little more than an afterthought. So it's our job to move social care out of the footnotes, out of the margins, and put it centre stage where this essential public service belongs. So yes, the NHS does have its own people plan. It may not be perfect. There's no price tags attached to various laudable aims, but at least it exists. At least the future workforce is recognised as central to the future of the NHS. In short, there is at least a plan. And it's a recognition of the need to provide direction and goals for the service in the way it approaches the organisation of the workforce, the way that staff need to be equipped to deliver for those they care for, and crucially, the way that the workforce can and should expect to be treated. There's no such equivalent for social care as we know. It's another telltale sign of the low status that the sector continues to be afflicted by. There are many other signs, which I'm sure we'll cover today. Turnover is extremely high. There are big workforce shortages. We know Brexit will only make that worse. And of course, far too many care workers suffer from insecure employment. Pay continues to be a major problem in the sector, And the excellent rally organised by this coalition last week highlighted that. The ongoing scandal that 3/4 of the workforce don't receive the real living wage. And on this, while I have your attention, I would ask, if you haven't already done so, if people could sign Shan Stockham's parliamentary petition on this very issue. So we want to tackle some of those big issues today. We know, in many cases, we know what the problems are. We've talked about them for a long time, but what we need now are solutions, realistic solutions, sometimes short-term solutions, but with maybe the longer-term ones, obviously taking a longer time, funnily enough. But the pandemic has highlighted the importance of social care and the importance of care workers. And now it feels like a one-in-a-generation opportunity to actually get the change that we need. So we have a brilliant range of people involved today. And there's a good consensus, I think, between us on the need to begin social care reform by focusing on the workforce. In a sector so dependent on human interaction, where sort of people-to-people relationships are what sustains the service, it makes perfect sense that we should focus on the people working in that sector. It is time for a people plan for the social care sector, and I hope that you find the rest of today's experience worthwhile, and that we actually come up with some concrete proposals to take forward. So I'm looking forward to the rest of the day. Thanks very much.
Christina, thank you very much indeed, from the heart there, and much appreciated, and reminding us of the journey we have travelled, and as you say, how we can now take that next step forward to really put the social care workforce centre stage this time. Not one chapter in a wider document. I get that. Okay, thank you very much indeed. Now let me invite Sir Andrew Dilnot, Chair of the Commission on Funding of Care and Support. Andrew, I can see a symbol, but I can't see you.
You're about to be able to see me. I've just been unmuted and I'm here.
Well, thank you very much for joining us, and please make your contribution.
Well, thank you. It's great to see everybody, and this is an exciting day. I want to be upbeat about all of this, partly because we should celebrate care. We should celebrate longer lives. We talk all too often about the burden of aging. It's fantastic to live longer. As I get older myself, I'm delighted by it. This is wonderful. We should celebrate the quality of life that in many cases is made feasible for people who need social care by the wonderful people looking after them. And above all, we should celebrate the fantastic work of carers, formal carers and informal carers too. One other thing to note right at the beginning is that although I'll talk largely about older people, we should be really clear that social care and the reforms to social care that we hope will happen have to be about not just older people, but people of working age and children too. People of all ages can need help to lead the best and most fruitful lives that are possible. And although there's a natural focus on older people, that's not the whole story. In all of this, I think the thing that we have to be clear about is that social care is something that we can only do together. We can only do it as a whole society. Most of us won't need much social care through the rest of our lives. About a quarter of us will need none at all. But probably only 10 or 15% of us are going to need a lot of social care. We've no idea which 10 or 15% that will be. It will be crazy to try to address social care and the funding of social care on our own. The idea that we should save up enough as individuals so that if we end up being one of those who needs a lot of social care, we can manage is just stupid. It's completely infeasible for most of us. Most of us would never be able to save up enough to pay for our social care if we ended up needing 5, 6, 7, 8, 9, 10 years of residential care or 20 years of domiciliary care. It's not something that we can do on our own. We have to do it together. We have to pool the risk so that everybody is covered. And of course, we do that already in lots of other areas. In health, the risk is entirely pooled through the NHS. Our risk is pooled for car crashes or for our houses burning down or for our pensions. We provide these things collectively. We must do it together. This is often thought of as being an insight from the left, but it's not an insight from the left. It's an insight from basic economics, and it's an insight that was completely understood by Winston Churchill. So Winston Churchill, who was involved in the introduction of social insurance in this country in 1911, came back to it in a wonderful speech he made in 1943, looking forward to the post-war period. And he said, "Here is a real opportunity for what I once called bringing the magic of averages to the rescue of the millions. Therefore, you must rank me and my colleagues as strong partisans of national compulsory insurance for all classes, for all purposes, from the cradle to the grave." Now, we've already done what Churchill was talking about in the case of unemployment insurance, in the case of the health service in 1948, in the case of pensions. The only big risk that's left, that faces us all, where we haven't pooled the risk and delivered collectively, is social care. Now, you might say, oh, he's going on and on about funding again. That Dilnot, he's always going on about funding. We're talking about the labour force, about workers, about their conditions. Well, the reason I'm talking about funding, apart from that I always talk about funding, is the only route to better pay, to better conditions, to more structure and opportunity for staff, for more investment in staff, is a funding model that works. And there are three things that we need to do. First of all, we need to deliver extra funding for the means-tested system now. The means-tested system, delivered by local authorities, staffed by wonderful people, is underfunded, it's not providing adequate care, and it's not providing fair eligibility. We have to put more money into the means-tested system in the short run. That's the fundamental bedrock of doing this properly. The second thing that we need to do is that we need to reform the means-tested system the way it works, to remove the crazy cliff edge that occurs at £23,250. We should, instead of having a cliff edge where you lose all eligibility beyond that point, we should have a gradual tapering down to, say, £100,000 or so. And then thirdly, and crucially, we need to pool the risk facing the population as a whole. We all need to channel our inner Winston Churchills, cap the catastrophic costs that everybody faces, effectively introduce social insurance with an excess. The cap is just the excess in the insurance policy. We argued way back in 2011 that that cap should be set at £35,000. That will be the equivalent of about £45,000 now. These three things not only would transform the experience of those who need social care, but by doing that would open up the chance to create a dynamic and innovative and exciting sector for the wonderful carers who are working in it. And unless we sort out the funding, we're not going to be able to sort out pay and conditions and training and career paths. It's absolutely clear what we should do. We've been dilly-dallying for far too long about this. Let's get on and do it. Thank you.
Andrew, thank you very much indeed. And it's a pleasure to hear such a clear and lucid description of a path that we can be taking. So thank you very much indeed, which kind of nicely takes me over to you, Alistair. Alistair Burt, Right Honourable Alistair Burt, former Minister of State for Care, Community and Care Services. I think that's right, Alistair. You work with Jeremy, and as Jeremy can't be with us, I know Jeremy would have been a huge supporter of this conference. I know he supports the coalition's objectives. So thank you for stepping in for him at this very short notice, and we'd be very grateful to hear your thoughts on this whole agenda and indeed the wider agenda that's now before us.
Well, thanks, Phil, very much. And it's a great pleasure to be able to take part in the conference, though, of course, with an element of disappointment for people who would have wanted to hear the chair of the Health and Social Care Select Committee. But I've been in touch with Jeremy, and just to say, I know how he would have started off this afternoon. So with permission, just let me, although I'm not going to represent Jeremy in any way during the rest of my remarks, and indeed, I don't speak on behalf of the Conservative Party or anything else. I'm here as an individual supporting the conference and supporting our coalition. But I do know what Jeremy would have said to kick off, and he would have said, it's a real honour to be with you today. I want to start by saluting our heroic social care workers who've really shown their value during the pandemic and demonstrated why they should be paid a fair wage, have great career prospects and work in better conditions. That's why the Select Committee, which I chair, has called on the government to inject an additional £7 billion per year into the social care sector. This would fund an increase in wages linked to the living wage, increased demands based on demographic changes, and Andrew Dilnot's proposals to ensure people don't face catastrophic care bills. Sort of says it all, really. And but as you want me to continue for a few more minutes, I will take it from there. But I hope that that does reflect not only the committee's view, but Jeremy's view in particular. I served with Jeremy when he was Health Secretary and we were dealing with social care. It's a great pleasure to follow Andrew Dilnot. We've known each other for more years than we would either care to acknowledge. But Andrew will also know that perhaps one of the worst telephone calls I ever had to make as a minister was in 2015 to him, when just after the Conservative Party had won the election, I had to phone Andrew to say the government was going to delay the implementation of his excellent proposals going forward with social care. It is a mark of how deeply that has sat with me that I'm still with you today, and I remember it. Like Andrew, I never quite left social care, even after I left the government. I'm the president of Carers in Bedfordshire and have maintained my contact with social care and others over recent years. And like Jeremy Hunt, I have appreciated that despite all the difficulties we had been through with finance, this is something that simply cannot once again be put to one side. And there really has to be a genuine commitment. And I think we have an opportunity to do it. As I said right at the beginning, I'm not here as a representative of the Conservative Party in any way, but I am still a Conservative. And I'm quite sure I do represent a strand of Conservative thought that recognises we can't go on like this and something must be done. I do emphasise, however, that this is a cross-party approach, and that's really important. What Andrew was saying in his remarks about Winston Churchill chimes in with a number of things that people have said and I've written about. The pandemic has produced almost a wartime-like atmosphere in terms of looking at our society, examining what has been exposed and thinking ahead to the future. One of the great things about the 39-45 period was, even in the midst of a physical conflict, politicians and the community were already thinking about what sort of Britain did they want afterwards. There were commissions put together, notably the Beveridge Committee, but also those who produced R.A. Butler's Education Act. Cross-party, involving the community, no politics, saying something profound has happened to our country. What are we going to do? And I think that social care falls squarely into that. And I have written recently in various articles on websites about the need to have that same sense, that same spirit. It will take sacrifice on both sides. Anything to do with health is an easy rallying cry for people with an ideological bent. Just have to be careful about how it's handled. That isn't in any way a suggestion that people should not make a strong case for what they believe in. But if we're going to get somewhere and get somewhere together, we have to work with each other. And that does mean maybe putting the politics second while we make a case and all work together to put it forward. Because I think the pandemic has changed things. I think Britain is different. It's not that we have discovered new things. It is the pandemic has shone a merciless light on things that don't work, on inefficiency, on inequality, on the issues that are described broadly as levelling up, and on who gets the worst both of healthcare and who gets the worst in terms of dealing with healthcare and looking after other people. And social care has come slap bang into this. So my sense is that what we must do now is work through these different issues and find a pathway forward. And that's one of the things that the conference is about. I was pleased to see some of the NHS announcements today. It seems that lessons have been learned from recent years, some of the things that have gone wrong and that need to be put right. I was pleased at the recognition of local delivery and local integration, because if social care is going to work, there's got to be a very close connection with social care. I was the minister partly responsible for getting the integrated care to Greater Manchester, which I think is proving to be a great success. And I think even though ministers do want to make sure they can make decisions about the NHS, and that will appeal to Labour, Lib Dem ministers as well as Conservatives going forward, the delivery has increasingly got to be local if it's going to work. And I think it's necessary to do that. But what we're here today to do, and I'll finish on this, it isn't just about the structural reforms and things that are to come. And Phil was right. The NHS press release and white paper will deal with social care to a degree, but it's clear more is to come. It is to look at workforce issues, because we cannot go on trying to provide care to more people and have a workforce treated as they have been. Hence the determination, now that we have found that if things are really necessary, money can be found to provide for them, that we concentrate on the workforce and those providing the delivery. And that's why making sure that that 3.9 billion goes in quickly and urgently in order to make sure that we have the resources to deal with the needs for good wages, good career prospects for those in care as a priority, as well as dealing with the demographic issues. That's why that's so important. Jeremy would want to leave you with the sense that as the NHS plans for 10 years, so social care must as well. He wants to see a 10-year plan. He wants that spirit of the Attlee government, of the wartime coalition, the Attlee government to come forward. And I think it's possible to do so. I think across the parties, colleagues in the Conservative Party and others in other parties can see that there are places where we have to try and work together if we're to solve the country's problems going forward. Social care has been crying out for that approach, and I'm sure each will have their individual contribution to make, but if we can make it collectively and use the power of people out there who really do feel this keenly, I hope we can get somewhere. The conference and looking at detail in some of the next sessions will help in that process. And you have a great advisory board, great coalition all pulled together, representing every part of the social care spectrum. I'm quite sure we're going to take this forward.
Alistair, thank you very much indeed. Maybe you should go back into government, Alistair. Maybe this is where we should. That's the way to solve this problem. Listen, we've got a few minutes now for the panel. That's Christina, Sir Andrew, Alistair, to take questions from those of you that would like to put questions. I think I've been told that Sian Stockham, who actually is a care worker and I know was involved with the rally last week, would like to put a question. So I'm just going to say to the elves behind the scenes, can we ask Sian to ask that question?
Hi. Can I ask, when can we, as care workers, expect to see a salary increase of the minimum of the real living wage, so no one gets left behind, and we're all valued, if you like, as called for in the parliamentary petition I started, which now has been signed by tens of thousands of members of the public?
Great. Okay. I don't know which one of you would like to have a go at answering that plea.
I mean, I don't mind just.
Okay, Christina. Yeah.
Just, I mean, obviously, I know Sian because she's vice president of her union, and she asks a very pertinent question. I mean, that's why we've chosen, that's for Unison, why we're doing this is to focus on the workforce. And I know Andrew said obviously funding is important, and no one would say funding is not important. It's critical, isn't it, going forward? But what we've been trying to do is avoid getting tied down in the detail of what structural change needs to happen. And actually we're saying as a very minimum, we need to invest in the workforce. Sadly, Sian, I can't give you a guaranteed timetable because we're still pushing for this. But I think the fact that we're gaining momentum amongst, I mean, I've just looked at the list, the participants list. We are gaining momentum and support from such a wide range of people. I think it does feel this is our single biggest chance to make that significant difference, where we actually get decent pay in for the workforce.
I should just to say, Sian, there's no one on the call who represents the people who control the purse strings, so nobody can give you an honest answer to your question. But what I think we can say, as Christina has just said, it is a question about valuing and recognising the workforce and getting that in front of people and in front of Parliament, so that they don't spend all their time talking about the structure, but they spend their time talking about people. And in order for this to be carried forward, there is, as always, no better way than people who are involved to contact their members of parliament across the spectrum, you know, put very clearly what the situation is, what people have been through, what the situation is for those who are not on the national living wage and in difficulties, and ask those who will make the decisions and vote and control things when they can bring something forward. So I think the determination of this conference, and the reason why it focuses on the workforce, is to carry through what Jeremy Hunt has said himself. His committee has said a £3.9 billion boost is needed urgently, and that is to address workforce conditions and wages, as well as to deal with structural issues.
Thanks, Alistair. Okay, I've got one other person I know that wants to ask a question. Somebody called, I think it's Gemma from PA. Actually, we've got different people from the media here. I think this is somebody from the media. Is it Gemma? Are you there?
Hello, can you hear me?
Yes, we can. Hello.
Hello, hi. My question's for Sir Andrew. I just wanted to ask what your thoughts were on today's white paper. Obviously, there's several social care proposals in it. The government said it will bring forward separate measures on reforming the sector later this year. And charities and care groups have said they're disappointed this isn't being addressed now and that they don't think what they've seen today has gone far enough. So I just wanted to ask really whether you think the government's missed a key opportunity to address these very real and pressing issues that we've heard about today that have been highlighted by the pandemic.
Thank you, Gemma. I have to confess, I haven't yet seen the white paper. I've been stuck in other meetings all day today, so that's a joy awaiting me later on. But I think I have a sense of the broad outline, which is that the proposals and commitments that we're all looking for a substantial reform of social care have been put off to a later date. My understanding is that we've been told there will be proposals later in this year. This has been going on for too long. I mean, it just has been going on for too long. We need action and we need it now. I'm not surprised that nothing has been announced today, because fundamentally this requires more money, whether we look at it through the lens of the workforce or through the lens from the other side of funding. We need to be spending more money on social care. We need to be paying people more. We need to see more investment. We need to see more people being looked after. I think that means that our hope has to be, well, we could be ambitious and hope that announcements would come in the budget next month. I very much hope that will be the case. I think more likely is that this is a debate that will be played out in Parliament and behind the scenes over the summer as the spending review goes on, and that the best hope for this is that we will see a really substantial announcement made as part of the spending review in the later summer or into the autumn. And to achieve that, to go back to all that Christina and Alistair have already said, what we need is as much noise as possible. It's all too easy for social care to slip back into the shadows once the most acute phase of the COVID crisis is over, and for social care once again to become something that people don't think about enough, that they don't talk about enough. And we need to recognise that the social care system that we have at the moment, despite the wonderful work done by our carers, is not adequate. It's not something that as a nation we can be proud of, because we're not putting enough resource into it. And that's something that I wish had been resolved 9 years ago and 8 years ago and 7 years ago and last month and this month. I think realistically our best chance now is either the budget or more likely in the spending review this summer, and we all need to make as much noise as we possibly can.
Thank you. Right, now I've now got three people who have questions. I'm going to take them in a group of three, if that's all right for the panel, and then we can pick them up. Sarah Johnson, Samantha Barron and Caroline Taylor are the three that I've been alerted to want to ask a question. Let me kick off. Samantha, would you like to start with your question, please?
Yeah, my name's Sam Barron. I'm a professor of social work at the Open University. I've got a question for the panel actually about why do we assume in the development of the social care plan that the plan will necessarily include individual financial contributions when health is free at the point of access. For me, that's a kind of a lack of acknowledgement of some of the very basic requirements that social care provides, food, for example. When we compare that to something, for example, like health prevention, why would health prevention be free, but actually the provision of food be a means tested activity?
Thank you. Good question. So my second question was to Sarah Johnson.
Hiya, Sarah Johnson here from the Living Wage Foundation. Really positive to hear about the funding commitment that Alistair Burt mentioned and it being linked to the living wage. We know the Resolution Foundation has calculated that it's going to cost £1.4 billion to implement the living wage in social care. So could Alistair Burt say a little bit more about how the funding will link to the living wage and if that 1.4 billion will be committed to implementing the living wage in social care? Thank you.
Okay, thank you. And lastly in this group of three, Caroline Taylor.
Hi, Caroline here, an ADAS associate. Having worked with the NHS on their people's plan, they benefit as a direct employer of having an enormous amount of data about their people and often live data. Social care as a diverse sector doesn't have that, and often any data about our people is retrospective. Would a registration system for care workers help professionalise that, provide the data and help on the journey that our panellists have described, given that Wales have already done that?
Three great questions. I'm going to direct them to each one of you in turn. Only one question each, as it were, because of time. And by the way, if everybody who wants to ask questions, if you don't get a chance in this plenary session, obviously you can raise your question and make your contribution in the mini summits. But the first question is, so why should individuals pay for parts of their care where the NHS is free? I'm going to ask Sir Andrew, would you like to have a go at addressing that one?
Yeah. So I think that is indeed a very good question. We in the case of healthcare, we pool the financial consequences of ill health altogether. It's not quite true, of course. We have things like prescription charges, but essentially we pool them together, and that's like having a cap of 0. And we could do that in social care. I think there are two reasons that that's pretty unlikely to happen. The first is that the cost of doing that would be sufficiently large that while economically, I'd argue, perfectly feasible, I think politically it's hard to imagine any government at the moment going for it. The second is that actually when you talk to the population as a whole, the majority of the population thinks it's not unreasonable that they should contribute to in some way to their social care needs in old age. And so what people seem understandably most concerned about is the risk that they could be one of the unlucky ones. And that while of course we all want to pay as little as we can, most people seem to think it's okay to make some contribution, just that we shouldn't be faced with an unmanageable amount. So I think it's a perfectly legitimate thing to call for, and making it altogether free would set the cap at 0. The proposals we made took the risk to which people are exposed from infinity down to £45,000 in current prices. In the end, that's a political decision. The level at which the cap should be set will be a political decision, and the more willing a government is to raise taxes, the lower you might expect them to set the cap. The less willing, the higher.
Thank you very much. A good explanation. Thank you. And people can make their own minds up on where they lie on that spectrum. Alistair, one of the questions was to you about the links of pay rises to the living wage. I don't know whether you want to come back on that particular point.
Yes, I'm very happy to do so. But again, I think I have to remind, I think it was Sarah, it's easy for me. I don't have to vote on this or make any decision upon this. And so there's nobody here who can give you the answer to that and say it's definitely going to happen. What I can say, and what I was very interested in, is the Health Select Committee's commitment to this, and to recognise that the national living wage ought to be the yardstick and benchmark. And I think that gives you a sense of where Parliament is thinking, because that committee is comprised of members of all parties. And when we talk about the total sum, 1.4 billion, well, I have to say, a little while ago, that used to be a big number. But I can't remember what the current figure is for the pandemic. Is it 400 billion or something like this? The sums have become colossal. And the advantage to those of us who are carrying forward this case for care workers is almost any individual campaign you come up with, if you compare it to the total costs of the pandemic, seem incredibly small. So the argument is, if government can find the money that will support so many people at so much money, why can't we find the money for something as important as this? The people who we've seen on the television, the people who we've seen struggling in care homes, the people who've been affected so tragically by those they've had to care for. It's a very, very powerful case. And the national living wage is there for a purpose, and it has a point that we can all recognise. So although I can't say that it's going to happen, it's going to be linked, I think there are arguments, good arguments that can be made that demonstrate it is value for money if people want to get that down that line, but also it is the right and moral thing to do. And I think one of the things the pandemic has done has reminded us that values have changed. The most important people in society are not who we thought they were 2 years ago. And recognising that in the Britain to come will be important for all of us. This is not a bad place to start.
Thanks, Alistair. Christina, there was a question about a registration scheme and whether that would be a way forward for trying to make a social care people plan a reality, because you need the database behind that. I was going to ask you if you could have a go at that question. I don't know what your thoughts are.
Sure.
And indeed, anything else.
Yeah, I mean, we've been calling for a long time for registration of a certain level for social care workers, and indeed for other categories of staff, but particularly in the social care workforce. And I think a couple of the things that could flow from that. One is it would give you an opportunity to have hopefully some better data and ways of communicating with people in the social care workforce. But I mean, it kind of links in as well to what we've been calling for, which is some minimum training standards, or not just minimum, but have minimum and then additional training standards above it. And as Andrew said, that obviously also costs money, but there's the benefits of that surely have to be that it's about linking into standards. So you know, people are kind of expected to do these jobs with very little in the way of standards or control over quality of what comes out at the end and the impact on individuals. Can I just quickly say I'm trying to monitor the questions, but it's quite difficult because of participation. And I've seen that Clinton had put in a question, and I know this is an issue that comes up, is about how can you have the discussion about the workforce without involving the people who actually are the service users in this. And I think that they're all great points, and part of the work of the coalition has been to make sure that we work with carers organisations as well, and representatives from that group, and service user organisations and unpaid carers organisations as well in this. So I'm sorry if I can't get back to all the answers, but to all the questions in the chat, but just to make that point.
That's great. So, and again, if people haven't had a chance to ask the question here, actually, I was going to ask Clinton if he wanted to ask his question. And if anybody, I think there's somebody from Sky and somebody from the Daily Mail. If you want to put your questions, put them now. But first of all, Clinton, did you want to ask your question of the panel?
Thank you. My question is regarding how can you imagine the workforce of the future without properly involving the people like myself and many others who draw on the workforce?
Great, thank you. And I know that's sorry, Christina, that's the question you've answered, but I don't know whether either Andrew or Alistair want to come back on that point. But just before you do, is there anybody, was either Daniel, is it from the Mail, or somebody from the Sky want to ask questions? If not, That's it, you've had your chance. Okay. Listen, we're going to move on, and thank you very much indeed. I thank Christina, Senator Dilnot, and the Right Honourable Alistair Burt for joining us on the panel. And we're now going to move into the next part of the session, to the mini summit. And as we go in here, if you've got thoughts about how we should be approaching the whole funding issue through the lens of economic growth, I know that's been talked about. If you go into these mini summits and you want a health and social care people plan, not one, not the other, but both, if these points you want to make, then please do